Brain and spinal cord arteriovenous malformations are congenital diseases that cause intracranial hemorrhage or permanent disability, especially in young patients.
During these years, we also found the emerging literature report that these lesions are associated with mutations commonly found in tumors, mainly in PI3K and RAS MAPK pathway. For example, this is a 7-year-old young patient with AVM after our partial resection, and 4 years later can see the totally regrowth of the nidus. We're curious about is there any other tumor-related mutations in brain AVM? Is there a similar somatic mutation way in spinal AVM? So we used the ultra-deep second-generation sequencing to discover the brain AVM and SAVM with a panel of 422 tumor-related genes.
Droplet digital PCR to confirm the panel searched mutations and identify the additional low variant frequency mutations.
Main findings. In this case series, we have recruited 21 brain AVMs and 10 spinal cord AVMs. We only recruited the true nidus type and sporadic AVMs. These are the detail of the clinical features. We use the next generation sequencing of the tumor panel. They help us to reach the average sequence depth of over 1,000. Very deep sequencing help us to find the low frequency mutations in the AVMs. In total, we have found 6 types of the KRAS mutations and 1 type of the BRAF mutation. This is also the first time that the BRAF mutation was found in brain AVMs. In total, we have found 87% of the central nervous system AVMs harbored the KRAS and BRAF mutations, comparing with the earlier finding in New England Journal that 63% of the BVMs harbored the KRAS mutations. We have confirmed their findings, but with a much higher prevalence. In addition, we have found for the first time of the spinal AVMs shared the similar mutation in KRAS and BRAF with the brain AVMs. And except the genes in this pathway, no other gene mutations were found in our samples of more than 2 cases. When we correlated the mutation with the clinical features, we had found that the mutation variant frequency were negatively correlated with nidus volume and the largest diameters, but not the patient ages. It tells us that the larger the AVM is, the lower variance frequency is. It may imply us that these mutations are the start point of the whole AVM pathophysiology.
Brain and spinal cord arteriovenous malformations are very difficult to be treated. Many cases cannot be treated with present available method, or cannot be controlled. In our results, we found nearly 90% of somatic KRAS and BRAF mutation in central nervous system arteriovenous malformations. These results bring us a very attractive potential treatment target. Perhaps in the future, we can use medicine to control or cure these difficult lesions without surgery or without endovascular treatment.
However, there are still unanswered questions. Whether is KRAS BRAF mutation the single and sufficient causative event for brain and spinal arteriovenous malformations? Whether is the second hit needed, or special targeted exome sequencing arteriovenous malformation panel, including both tumor-related somatic mutation genes and vascular malformation mutation genes, could be developed for the precision medicine of arteriovenous malformations.